Hello and welcome to this special edition of The Heat. I'm Anand, Naidoo, and in this time of the pandemic, we've had to adapt our broadcasting, so I'm coming to you from my home just outside Washington, D.C. Scientists are warning the coronavirus could be with us for years. A study issued by the University of Minnesota says if COVID-19 follows the pattern of the 1918 Spanish flu, the pandemic may last 2 years and result in even more deaths this fall and summer. With over 1 million confirmed cases in the United States, the US Trump administration is working to speed up the development of a vaccine. Globally, the World Health Organization says there are over 100 vaccines in the works, with several beginning clinical trials. The US Food and Drug Administration approved the antiviral drug remdesivir as a treatment for severely ill patients after it showed some success in quickening recovery time. It's expected to be available this week. Joining us now via Zoom from New Haven, Connecticut is Rafael Perez Escamilla. He is a professor of public health at the Yale School of Medicine, and Dr. Anna Caggiano is the chief of the pulmonary and critical care department at Prima Care in Fall River, Massachusetts. Thanks to both of you for joining us.
Thank you.
Thank you.
Rafael, let me start with you. That study done by the University of Minnesota warns that the pandemic could last up to 2 years. We could see a very high casualty rate in a second wave in the fall and in the winter. What do you make of that?
Well, I think that is going to be in many ways the new normal. We fully expect that this will be an ebb and flow type of situation where we reopen carefully for some time. It's very likely that COVID-19 will return with some intensity, and it is crucial that we have enough testing, contact tracing, and quarantine measures in place so that we are able to mitigate any possible return of the pandemic in the not too distant future.
Rafael, you say it's crucial that we have enough testing and other facilities to combat this virus. Do you think we will be prepared in the months ahead?
So quite honestly, in the US, we have still a long way to go. Many of the states have chosen to start reopening even before the federal guidelines were met with regards to at least 14 days of continuous declines in the number of COVID-19 hospitalizations or cases. We still have limited testing. We're doing much better, but we need to have much more to actually be able to open up more comfortably a number of essential venues that I know everybody is eager to have access to in the near future. So I think that it is going to be very important that states keep close track of any rebounds in number of hospitalizations, of course, deaths due to the pandemic, and as more testing becomes available, that we actually do a much better job at letting people know that may have been exposed to someone with infection that they need to quarantine themselves. Without this happening, I am concerned that in many states, or certain regions in some states, they will need to go back to lockdown pretty soon.
Dr. Caggiano, let's look at the situation in Massachusetts. At last count, there were 68,000 confirmed cases, and more than 4,000 people have died from COVID-19. The governor of the state, Charlie Baker, he's extended that emergency essential workers order to May 18th. Now, you are one of the leaders in fighting COVID-19 in Southeast Massachusetts. What is your assessment of the situation there?
So here in Southeast Massachusetts, actually, our situation is not as bad as closer to Boston. So it's based by region, but we are overwhelmed with the amount of patients who are coming into the hospital. And in fact, one of our regional hospitals became a COVID hospital where we extended our usual 12-bed ICU to another location in PACU, or post-anesthesia care unit, and we doubled our numbers of intensive care unit beds. The whole hospital is actually filled with patients who are with COVID-19 sick, and they're quite sick that they need hospitalization. In fact, I have been recovering now myself from from COVID-19. I had some symptoms for about 5-6 days. Mine were very mild and I stayed home. I didn't go to work, but a lot of patients go to the hospital quite late, unfortunately, and we find them in a critical condition where they require a lot of oxygen and sometimes intubation. And we know that these patients who end up getting intubated, their chances of dying are very high. In fact, we lost quite young patients, despite everything we've done for them. Also had good success, sending a lot of patients home. In fact, one of my sickest patients who was in the mid-30s, after 2 weeks on the ventilator, we extubated successful, and a few days later was sent home on room air, basically without oxygen. We were so happy to see that we were able to get him home.
So, Dr. Caggiano, it's clear that this virus affects people differently. Now, you say in your case, you were just infected and you felt the symptoms for a few days.
Yes, I'm still a little bit weak and tired, mostly muscle aches and pains and headaches. I didn't have high fever. I was exposed to a patient who was initially negative, and I didn't have an N95 mask, just a regular mask, and of course all the protection, because N95 mask is not recommended in every patient who are coming to the hospital, right. Of course. And this patient, had very unusual presentation, came with a different reason. The test was negative, and I saw the patient from a different reason, and then later on, she converted. She started to have shortness of breath and low oxygen level. We tested, and she was positive. It was already 3 days after I saw her, and actually next day, after 4 days, I started having symptoms. I did have a mask, and gloves, but things happen. So she started coughing with me in the room, and I guess I was exposed to that. So.
Right. Rafael, the Trump administration here in the United States, they're moving very fast to get a vaccine. In fact, the effort is called Operation Warp Speed, and the hope is that they will get a vaccine by the end of the year. Do you think that's realistic, a realistic timetable?
If we're very lucky, it may be realistic in the sense of having a relatively effective vaccine tested by then. But keep in mind that here we're also talking about that need to distribute hundreds of millions, if not billions of dosages all over the world. And that is an incredibly complex task that you need to have the capacity to manufacture them, and then there needs to be global infrastructure in place for the proper dissemination and distribution of the vaccines to happen. At the end of the day, it is a pandemic, meaning that it is a global humanitarian emergency that knows no man-made borders. So it really has to be done in close coordination and consultation with international agencies such as the World Health Organization. I don't see any other way about it. And I don't think that it will be possible for all of this to happen between now and January, to be honest with you. But if we get lucky again, I think one of the multiple vaccines that are being tested are probably going to show very promising results by then.
As we said in our introduction, there's something like 100 vaccines in the works right now, Rafael. How is all this work being coordinated? There are different scientists and researchers in different parts of the world.
Yes.
How is the work coming together?
Yes, so my understanding, as I am not directly involved, of course, in the development of the vaccine, but my understanding is that there is quite a bit of sharing across countries. We know that a team in Oxford in England is also very, very aggressively, in the good sense of the word, trying to have a vaccine pretty much ready sooner rather than later. And I know the scientists at NIH under Dr. Fauci's direction are very much in touch with the researchers in Oxford as well as researchers in Germany and other parts of the world. The whole idea is also, of course, that this should be a very, very healthy race. It's not a race to see which one gets the patent first to become the wealthiest nation on earth by selling the vaccine, but rather how can we all cooperate? And by we, I mean the scientific community together with decision makers, so that this is seen as a human right at the end of the day, the free access to this vaccine as soon as it is safely to distribute it.
Dr. Caggiano, one of the alarming figures that I saw coming out of Massachusetts was that more than half the deaths in that state have taken place in long-term care homes. What has made people so vulnerable in these homes?
So, of course, you know, the long care homes usually are, you know, resided with folks who are older and with a lot of comorbidities. Those are patients who cannot be cared at home usually. So those people are quite sick. Unfortunately, with coronavirus being, you know, in some patients asymptomatic, some healthcare workers and, you know, whoever goes and visits the long care facility may carry actually the virus and may give it to those patients. And those patients, unfortunately, are the most vulnerable. We know that mortality after the age of 70 is quite high, especially, you know, if you have all the comorbidities. You know, fortunately, most of the deaths were in older folks. You know, it's sad to say that, but, you know, to some degree, the children and the young are protected, or the children especially, which is, you know, our future. So at least, you know, we this virus, you know, is protecting our kids to some degree, although we did have deaths in very young, as we know, in infants as well, who don't have an immunity developed. That's the nature of this. And, you know, unfortunately, we've seen people, young people who have been hit as well, and especially young with some medical problems, especially diabetes and obesity. So those are the two risk factors, diabetes and obesity, and also hypertension, which comes along with obesity, actually.
Rafael, in the state of Connecticut, where you are right now, the number of hospitalizations have actually been going down. What does that signify to you?
Well, that signifies that we are doing a reasonable job at mitigating the pandemic here. In many ways, it also means that the citizens of Connecticut listened to the request from the governor and public health authorities to practice sound social distancing. And it really is telling us as well that our governor has been very cautious in spite of these improvements at rushing, as other states have done, to reopen the state before conditions are ready to do so. So we are continuing to see declines. If we see them for perhaps another week, I think very soon thereafter, our state will enter, you know, the first phase of reopening, so that we can really start you know, reopening like the laboratories at the universities, and for you know, essential jobs to actually being able to be fulfilled at the same time that we can reopen you know, restaurants, movie theaters, and so on, as long as social distancing can be kept. So I'm really proud of my state, because I think we are following the right steps that are required during these difficult times.
So you feel, Rafael, that the state would have fulfilled the requirements or the criteria of those guidelines that were issued by the White House?
I think, and even though we're so close to New York and also very close to Massachusetts, as the doctor has said, another state that has been heavily affected, our healthcare system has not been overburdened. And we're really hoping that that is going to continue to be the case. No one is just having the false expectation here that the virus will magically go away and everything will be back to complete normal in Connecticut. We're very aware that this pandemic is here to stay for a little while with us, but we are mitigating as much as possible And the governor has put in place a wonderful task force that includes wonderful scientists from my university and other universities in Connecticut to advise on the best way forward. So I'm very lucky to be here in Connecticut, I must say.
Dr. Caggiano, as someone who's recovered from COVID-19, what is your message to those who want to see this country reopen faster?
I have to say that this is not a disease that you want. People don't realize how bad it can be. Actually, I had pain as bad as I've never had in my life. I had pain all over my body and, going to my bones, worse than I had my 2 children. So this is not something that anyone would want to bear. And I had mild symptoms only. So please stay home. Please listen to the advisory, because there's no way we're going to get over this unless we are in this together. So I urge everyone to realize that this is not only your individual wishes, this is the wealth and the health of a whole country. And to protect our country, we need to follow recommendations. There's no way around this. This is not something that we should play with.
Okay, Dr. Ana Caggiano, Professor Rafael Perez Escamilla, thanks to both of you for joining us.
Thank you, Anand.
More of our show right after the break. You're watching The Heat.
In-depth stories.
All the coal that was mineable is gone.
As the days and weeks went by, a lot of innocent Iraqis were killed.
So this is my home. This is my home. This is the only place I know.
And this is why we think AI tutor could stand out.
That begins to shake the foundations of the global order.
Big Story Weekly Documentaries.
CGTN, covering coronavirus. From Asia, Africa, Europe, and America. The dangers, the uncertainty, a global effort to stop the spread and save lives. For the latest updates on coronavirus, stay with CGTN. See the difference.
Welcome back to The Heat. We turn our focus now to Italy, reopening after nearly a 2-month lockdown. Manufacturers, construction companies, and some wholesalers are back open, and a lift in restrictions means children can once again play in the park and families can reunite. We're joined now from Pavia in Italy by Leonardo Salvaggio, a blogger. Leonardo, thanks so much for being with us.
Thank you guys for inviting me.
Italy has been very hard hit by this virus. I'm looking at the numbers here, 211,000 infections and almost 29,000 deaths in the country. The government is now lifting some restrictions. The Prime Minister, Giuseppe Conte, says we are about to enter the phase of coexistence with the virus. What does he mean by that, coexistence with the virus?
Well, what happens here is that numbers have been drastically decreasing for the last several weeks, I would say, because new cases have been going down since the end of March, more or less. So since it's going down slower than it went up in the first phase, the virus is not gone yet, but we have some confidence now that we can start to reopen something. For instance, some companies in Milan have reopened, bars have reopened, and we are allowed, as you were mentioning, to go out and to walk a little bit more, and kids can play in the parks. This is not back to normalcy, not at all. That's why we are coexisting with the virus. Because, for instance, on trains, we can only sit on certain seats, meaning that you have to stay like 1 meter away from the next person, and there are only some spots where you can even stand. And even bars are open just to give you drinks and food to go, which is surprising to us. It's almost unheard of, because like an espresso coffee is something you drink in an instant, that you would normally go in, drink, and go out. So having to take one to go is something very strange. So that's coexistence. We're not back to normalcy. We're just kind of reopening something and get some bits, some shards of normalcy back.
So as you say, the reopening is very gradual, very slow, but generally in Italy, how is the reopening plan being received?
Being received? Well, I think that Giuseppe Conte a few weeks ago gave a speech in which he said that it's going to be gradual. So for instance, stores will reopen in 2 weeks from now. And there are some other services that will reopen even later, such as, for instance, hairstylers will open in June. I think that a lot of people are complaining, but I just see, well, I want to specify first, I see people complaining. I don't see people wanting to break the rules. So it's just a matter of communication, of complaining. I think that a lot of people are not getting the point correctly, because after you hear the prime minister speak on the TV, of course, it doesn't say everything in a press conference. He says something, it says the main points. Then you have to go study the documents, or at least to go read them. And if you read the documents by the government, they are generally clearer and more complete than what he says on TV. And even I know that a lot of hairdressers are complaining that they have to wait more or less 1 extra month. But I think personally that at a certain point, the government has to set a threshold. So we cannot open everything altogether. We have to decide what to open and what not. And the decision was that stores are opening and hairstylers are not. But he also said that this is the plan, and the plan can change if things go better or worse than expected.
Are there any fears in Italy that the government could be reopening too soon? I mean, in the first phase of reopening, you would see something like 4.5 million people going back to work. Have there been any concerns that this could be too early?
I think so, but also this is new. This is new also for the scientific community. So actually, I think that fears are justified because no one really knows for sure. Since the incubation period is maximum 14 days, we'll know in 14 days. But of course, there's some fear, and I think that it's justified, but we have no other option.
Now, you live in Pavia, which is south of the big city of Milan. What impact did the virus have in your city?
It had a big one. Like if you went for a walk in the center before the lockdown, you can see that the streets were stuffed with people. In particularly, we have the hospital and the university, which are the main parts of the city's economy. So you would see a lot of youngsters, for instance. But since then, everything was completely shut down. So in the last 2 months, you could walk in the street and see nobody, because there was nobody in the streets. So stores were closed, restaurants were closed, bars were closed, gyms were closed, no concerts and no music, for instance. So yes, it changed the way we lived completely, upside down within a few days.
What is the situation like right now?
We're getting some normalcy back. Like if you go outside, there's somebody who restarted going to their offices, because not all jobs can be done from home. Some people have to go to the office. And you can see someone going to maybe a restaurant or a bar. There's some more movement a little bit. So I think that people are being very conscious, because they're not thinking it's going back to normalcy in a couple of days. They understand this is transition between a phase and the next one.
Leonardo, of course, there are countries throughout the world which are counting the economic costs of this pandemic. Italy was among the first of the European Union countries to introduce a lockdown on March 10th. What kind of economic damage has this done to Italy?
Well, there has been a lot of controversy, because, of course, the economic damage is very big, because many activities were shut down. And for instance, let's consider again hairstylers. They haven't been working for 2 months now. But what I think is that the other option would have been not to close so much, but not closing that much would have been that the virus would have spread even more. that also would have caused an economic impact, because if more people get sick people can't work. So I think that it had a big impact, but I also think that it was the right choice to make, because the opposite choice might have been even worse.
Now, this lockdown actually had a very personal effect for you. You had to postpone your wedding. Tell us about that.
Absolutely, because I was supposed to be getting married on the 16th of May, so in 2 weeks from now. And I was supposed to be coming to the United States on my honeymoon, and I couldn't. So at the moment, my wedding is postponed to September the 20th, and my honeymoon is postponed to next year. And it's completely, unfortunately, it's completely normal. Many people are doing that. And so weddings and this kind of events are being pushed forward to the future. So yes, I've been personally hit, but I have to accept it. There was nothing else to do.
You know, Italians are very social people. The piazzas that you have in cities and towns are gathering places for Italians. They gather there in the morning to have coffee. They gather there in the evenings as well. So how difficult has this lockdown been for a country like Italy?
Well, it has been very hard to accept in the first days. I remember even myself thinking, isn't it weird that on a Friday night I cannot go out and have a drink with my friends? This is something we do on a regular basis. So what's going on? But I think that it took like maybe 2 to 3 weeks to accept that this was for some time a new normalcy. So I think that people now are accepting this. And we also found that it was very nice maybe to have a Skype or a WhatsApp video call with your friends, just to stay in touch, just to see each other and see how people are doing. So we are readjusting to a new normalcy that we also hope is not gonna last long.
Leonardo, good luck, and thanks so much for being with us.
Thank you for having me.
That was Leonardo Salvaggio talking to us from Pavia in Italy. I'm Anand Naidoo. This has been The Heat. Thanks for joining us.
Again, he can hold in guns. Machine guns from police forces toward the protesters.
Were you worried about your life at that particular time? Not at all.
The activity, thank you very much for your time now. What is your assessment of the state of the continent today?
Africa has the potential to power itself.
Excuse me.